Botox and fillers. Why do people get it? When do they get it? And who should get it? You know, I could talk about it all the time. Welcome. This is Rohrich Knose, helping make you a better you and a more informed you. And today we're going to talk about the non-surgical ways of looking and feeling better. Botox and fillers and all these things. And I have a beautiful woman with me who's one of my patients. Deana, welcome.
Thank you so much. Hello, everyone.
Yeah, and so we're just going to talk about some things that people think about doing and non-surgical things, and you know, like Botox and fillers. And so, first of all, Deana, tell me about yourself. You know, I know you have 6 kids. She doesn't look like she has 1 kid. She's so young. So
I have a good doctor.
Yeah. Okay.
Yes, 6 kids, 3 grandkids, a wonderful husband.
Wonderful.
That's such a blessing. I have a career that I love with wonderful people. And get to go to work with them every single day and walk alongside them. And
tell me about that. I mean, you just told me about it. She's a talent acquisition agent. So tell me about your job.
Yes, so talent acquisition. So I work for a brokerage called Monument Realty, and it's wonderful. We just got named, as a matter of fact, for the 3rd year in a row, the best place to work in DFW by the Dallas Morning News.
Really?
It's absolutely wonderful, and I get to choose the people that we work with. And so I look for 3 P's. I look for positive, professional, productive. And,
I love it.
And just get to bring them into the company and notice what's good and special about them and draw that out. And
so do they all work on site? Do they all work?
Well, they're independent contractors, so they're realtors all over DFW.
Okay. Well,
and then
neat.
I have a team of kind of recruiter coaches, if you will, and there are about 30 of them, and they help me find the best, most professional, wonderful agents in the industry.
That's good. And you're not a realtor. You're just a talent. She just knows how to select good people.
Yes.
I like that. From the moment I met you, I know that. I like that.
Thank you. I could say the same for you.
Well, you know, we all try and surround ourselves with people we like, and also that are better than us, that we look better. So,
yes, absolutely. So
good.
true. So true.
So, okay, let's talk about fillers and Botox. And when I say Botox, it's always about, you know, Botox is generic. I mean, obviously there's many neuromodulators that are available, Dysport, Xenamin, Jeuveau, all these are approved in the United States, and there are many others forthcoming that are going to be longer acting, and we're going to talk about that as well. But so when did you first start thinking about or doing Botox and fillers? And tell me about your...
You know, probably early 30s, actually. I have very strong forehead muscles, apparently, and so I noticed some of the fine lines and wrinkles starting to crevice a little bit, and so I wanted, you know, as preventative measure, I wanted to go ahead and you know, start taking care of that early.
And you started with Botox. And you know, that's called prejuvenation. In fact, now people in their teens, and I'm not necessarily saying there's a lot of science behind it, teens and early 20s that actually, if they have premature lines, that you can actually treat it with Botox or neuromodulator. And there's some soft science about that. I'm not saying one should advocate doing that, but sometimes, you know, there are people, in fact, we have a resident on our service now that has really premature lines of his forehead, and I think it'll just make them look softer. And it actually, there's some data to show that if you do that, potentially you delay that deep inset of the lines. But is that what you found? Or?
Yes, absolutely. And I just, you know, I've always wanted to kind of preserve what I have. It's the face God gave me, and I like my face, and so I want to keep it. I want to keep it.
Right, without having a lot of surgery, at least for a while. And, you know, that breaks my heart, but it's true because as a plastic surgeon, you know, we learn to do both, with the non-invasives and then the invasives later. So, so you've been doing that for a while.
I've been doing that for a while, and I just, you know, I do it because I want to look on the outside the way I feel on the inside.
Well said.
And I am a kind person. I want, you know, I'm approachable.
Right.
I don't want to look tired or too tired
or angry.
Yes, I don't want to. And I think as we age, sometimes our face just can take on that.
Yeah, that brings up a good point, because sometimes patients, especially males, come in, they say, my staff says I look angry, and I'm not, right? And so that's what we do, the vertical, the 11s.
Yes.
And it actually helps to soften it. Sometimes they even need fillers. So I think, you want to look as good as you feel, and then that helps you. And I think that's important. And that's a good thing to do. And people do that for their job. And so so they don't look tired. When people say, sometimes people say, I have several patients come in that just say, I just do it because people quit telling me that I'm looking tired when I have my Botox.
It's true. Yeah. It's true, yes. And I know it's time to come back in when someone says, "Hey, are you tired? Are you
are you okay?"
That's not the impression I want to give.
Right. And by the way, yesterday we did Dysport, which is a little longer assay, and she did Dysport, just minimal type of bruising, and we did a little filler here, and then there's little folds in the commissures, and you can see, she's beautiful anyway, and we can show a little close up of her later, but she looks amazing. So in your 30s you started that. So when did you consider start doing fillers? And I think that's a good age to do it, and that's really the most common time when I see people start using it.
Yes.
And now with newer neuromodulators coming out, they're going to probably last longer than 3-4 months. So I think that's going to probably be good. What do you think about that? Instead of doing it 3-4 times a year, do it once or twice a year. You think that's a good idea?
Well, I think it's a good idea if you trust the person doing it.
Right.
It's a risk if you don't. You're amazing. I was just telling someone, actually, funny enough, this morning I had my yearly checkup at my dermatologist, and it's a new dermatologist because my old one left. And so I was letting him know that if he saw little pinpricks or anything on my face, that I had gotten some Dysport and some filler, and he asked who did it.
Yeah.
And when I said your name, he just lit up like a Christmas tree, and he said, said you were the absolute best.
Wow.
and that everybody knew it. And so, I was telling him that I very seldom ever bruise or have swelling or even pain or discomfort. And it looks so natural.
And I think that's all part of the process. And I do full face Botox. So we went upper face, lower face, and around the lips and everything, the lip flip and everything. And then, no, I think that's good. And I think it does, it doesn't make people happy, but it makes people that are happy look happy, right?
Yes.
Because, happiness, surgery at Botox doesn't make you happy. Happiness comes from here, right? Do you agree?
Absolutely.
I can't take a sad person and make them happy.
No.
But you can make a happy person look happy.
You can make them look happy, and you also can make them more confident. I think too, is that
I see that.
Especially when I've come back from the things that you do to my face, I do feel more confident. I'm more relaxed. I just feel more like me.
Right. And wouldn't you say, that honestly we are a very youthful aged society, so people want to look as good as they feel, and especially if if you're getting beyond your 30s and 40s, people say, oh, you're getting more mature, but people want to look young and feel young and be in that groove, right?
Yes,
you agree?
Absolutely. One thing I love about what you do, Dr. Rohrich, is you don't try to make me look like someone else.
Right.
And it's so funny. I don't even know what kind of filler you used yesterday because I don't ask anymore. And what's really kind of fun about that is that I very seldom tell you what I want. I just trust you completely, and I look natural.
Right.
Nobody even knows I got anything done.
Yeah, and that's what you want. It's kind of like surgery. Yeah, and we did some RHA, which is a hyaluronic acid filler in the nasal labia folds, and then we did some blended Juvederm for a softer filler around the lips. And there are so many different fillers available today, and I've done the trials for many of them, so I know what works best everywhere. Yeah. They're all safe, they're all FDA approved, but it's really how you inject them and who injects them. And I think that makes a point about, choose your injector well, because you can get it done cut rate anywhere in the local spa, but you may not get somebody that actually has done a lot of it and may not be properly trained. And there are some downsides, not just, having asymmetries, but also some other things like loss of skin and other things that can be devastating. But so I think it's just choosing.
You don't group on your fillers and your
right. So what suggestions do you have for people that have never had Botox or filler? What do you tell your friends? What do you tell your friends?
Well, what I just said I think is the best advice. You don't group on some things. You don't group on heart surgery. You don't group on, like, this is your face, your one and only face, and you want to take care of it as long as possible, but you want to look like you. And so to find somebody that you trust is a gift. And you do that by talking to your friends and people that you like the way they look and their outcome, and you investigate and you research.
Then you find somebody. And then also, I think it's also, you have to see what they do in their work. And also, like, I will tell you that I probably do half of what my patients want me to do as far as, they say, I want all these things. And I say, well, let's start with this. And I try and start very slow. I will do, a modest amount of Botox, and then I'll do a modest amount of fillers, and not just pound things in, because people, like you said, you want to look like you. We're in the face protection, not witness protection program in plastic surgery, so we want to make people look good and not say, who's that?
Well, I can attest, doctor, because you've turned me down several times when I have had I thought was a really cool idea, but you have said you didn't think that would look right. So
and I think the biggest thing I see is in some of my younger patients that want lip fillers too much. They want too much lip fillers, and it just doesn't look good. And I will tell you, because the upper lip should never be bigger than the lower lip, except for in orangutans and giraffes, and not in Homo sapiens. And so, and sometimes in some of the people that we know in California have that, but it's not a good look. And long term, the other thing that people need to know is that fillers are not necessarily reversible. Even though the hyaluronic acid fillers, you can melt them. After so much time, I see patients with these huge lips. I can't melt that out, and it's devastating because these people. I just, in fact, did some surgery on somebody from the West Coast, and she's really been devastated, and it's going to take multiple procedures to help correct her face and lips. She has so much filler and other things in there that we don't know about. So restoring it is a real challenge. So don't put yourself in that situation.
No.
Because then you are really crawling your way back to being and looking normal.
Exactly. Right? Well, and it's especially important to me as a communicator.
You're a role model, and you people are looking at you and they're saying, "Hey, I want to be like you," but
Well, and I want them to hear the message I'm portraying.
Right.
I don't want them, staring at something that looks unnatural.
Right, exactly, like the big lips and things like that. No, I agree, and of course, as a plastic surgeon, I look at that all the time. I see people like in the elevator, and I'm going, boy, I just wish I could tell you, don't do that.
Right.
And I don't. Sometimes I'm tempted to, but I think it's good. So I think that's good advice. So seek out somebody that actually has experience, expertise, and that you trust. And it's not a Groupon thing. So many things in medicine and life. You can go to Walmart for some things, but you can't do that with your face, your nose, and with your fillers. The other thing that I see with these house parties and things is that when people go there are sometimes people are injecting things that aren't approved yet in the United States, and there's been a series here about, it's been a while ago, but where somebody that was outside the country came and injected an illicit filler that wasn't even approved in the U.S., and they had so many problems, a permanent filler, and basically they had so many problems for several years. Oh. It was a disaster, and you can't remove permanent fillers like silicone or other things. Oh. You have to cut it out, and it's a disaster. So, just kind of know before you go.
Yes.
You agree?
Absolutely. Yeah. So, yes.
So what other things would you say? So for fillers and Botox and things, have you done things like non-invasive things like peels, or have you done BBLs or broad-based light treatments? Have you done?
I have.
Yeah,
I have
yeah.
done. I like to do those every few years.
Yep.
I just think it's kind of restorative.
Right, and you use sunscreen, obviously. You look...
Absolutely.
Yeah.
Well, doctor, I don't know if you know this, but I had skin cancer last year on my right ear.
Oh, I didn't know that.
Made a believer out of me. So
oh, really?
I am.
So you're a native Texan?
From Oklahoma,
Okay,
so might as well
that's
be.
close.
Yeah,
that's close.
Close
Yeah,
enough, but just
right.
years at the lake, and
Right.
Right. You know, when we were growing up, we didn't talk about sunscreen really.
Well, none of us did, and you know, in fact, you'd go out and put on baby oil and things that were just awful to do. But right, so the key thing is obviously, you know, sunscreen, you know, and wear it 24/7, and you know, none of it's waterproof, and then use a retinol product, something that turns over your skin all the time, and then
Yes.
if you have you know, really skin damage, use a antioxidant like a vitamin C.
Absolutely.
Those are all things that are very, very important. And your skin looks awesome.
Well, thank you.
Yeah.
I use all of those. So,
So you do?
yes,
Okay.
Yeah.
And I think those are just kind of, you know, the building blocks. Those are the three of the major building blocks that you have to use. And I think, you know, that along with Botox has been shown actually to make the skin look softer. And I mean, your skin looks great, and obviously you've been taking good care of it. The biggest thing is the things you mentioned, especially the avoidance, sun avoidance, and then using really UVA, UVB sunscreen. So what other advice would you have before having any surgery that you think would be very useful for somebody that's coming from their 30s into their 40s and into their 50s, which is about where people want to consider having facial rejuvenation?
Yes. Well, I would say, you know, make an informed decision over time.
Right.
Research, and then consult somebody that you trust, a medical professional that you trust,
Right.
because not everything you learn on the internet is going to be, you know,
100%.
learn that the hard way. But I'm thinking about, as you ask that, there's a scripture that says there's wisdom in a multitude of counsel.
Right.
And so to talk about that, and of course I'm married, so I discuss everything, you know, with my spouse and get his feelings about it. And then I came in and talked to you, and you said yes to some things, you said no to some things, which I absolutely treasure. I really do.
Right, and that's what you want. You want somebody
Yes.
that's going to, you know, be open and honest with you. So I think know before you go for Botox and fillers. You know, it's a board-certified dermatologist, plastic surgeon, oculoplastic surgeon, or facial plastic surgeon that actually has experience and expertise. Just because, you know, everybody's famous on their own website and on Instagram, but most of them, many are not. And I think that's why you have to, hopefully this making you a better you and a more informed you is important, because we can guide you to the place that you can actually say, hey, this group of doctors, this doctor is very good.
Yes.
And then when you see them, and also you can look at, you know, not only their staff, but also their website and see what's going on. And I think that then you can kind of get a feeling of, you know, do I want to look in that range? And also, when they say no, I think that's very powerful. And I think to say, listen, I don't think we should be doing that much. And I say that to about half my filler and Botox patients every day, because, you know, we want to go slow. And I think you're right. People do respect that, because you can always come back and get more. And you just can't just
Exactly.
you know, so you don't want to be inflated like, you know, Stay Puft Marshmallow, like in the Ghostbusters, right? So, you know, but I mean, you just don't, you know, and you want to look normal, because the worst thing you can do is take somebody and make them look abnormal or like somebody else. And, you know, that's not a good look. And I don't want people to say, hey, Dr. Rohrich did that, right? And
Right.
so I think that's not a good thing. So I think, you know, your points are very, very valid. You know before you go. Take your time, and, you know, there's no rush in doing this. And Dr. Google is not a doctor.
No.
You know, he is available. He or she is available 24/7. He or she's wrong 70% of the time, and they really have become the 24/7 ER doctor. Unfortunately, like, you know, if somebody has a problem, they go on, oh, I got a lump, and I'm going, oh my God, and then there's like 50,000 options. So know before you go. I think that's the biggest take-home message. So in wrapping up here, so what are like the 3 points that you think are very important? You know, that you would tell your kids if they're thinking about having this eventually. I know your
And
kids.
they're at the age now, and we have 5 daughters and 1 son.
God love you.
And so,
really, 5
yes,
daughters?
Yes. So, and they ask from time to time. And, you know, I think one of the biggest pieces of advice is, you know, we've said research,
Right.
and we've also said everyone's a superstar on their own
Right.
website, and,
Right.
and pictures can be deceiving. What I love about what you do are your podcasts, because you can see real live people, and the transformations are astonishing and
Right.
look so natural, and people are so happy. But I think one piece of advice that I would give is go in, get a consult, and pay attention to your surroundings. One thing I love about your office, and that impressed me immediately, is the entire staff and all of the office. Everyone is so professional, so kind, adores you, respects you. And one thing I've learned is that you attract who you are.
Right.
And so they're excellent. I could name all of them. They return phone calls and emails immediately, shockingly fast. So do you.
Wow,
And
thank you.
so that conscientiousness, is that a word, Doctor?
Yes, it
okay.
is.
That's impressive to me, and that gives me peace of mind. Truly.
Well, that's great. And I didn't pay her to say that either. But no, I appreciate it. You know, and that's very important. You know, I mean, I surround myself with people that, you know, want to engender who and what I am too.
Yes.
And just like you do, that's why you're an incredible talent in your television, because you want people to hire them that, you know, you want to be around, right? I mean,
Yes.
life is too short. It's not a dress rehearsal. I don't want to be around people I don't like.
Nope.
You know, it's just, there's not enough hours in the day.
Nope.
When I call them life suckers. So
Yes. Time bandits.
Time bandits. Deana, thank you so much. Very valuable lessons here. Know before you go. Do your research. You know, less is more. Okay, enjoy. And helping you be a better you is very important. Please send us your comments. Tell us what you like, what you didn't like, what else you'd like to see and hear about non-invasives and Botox and neuromodulators. We're going to be talking about so much more, especially the more rapid neuromodulators coming up very soon. Rohrich Knose. Enjoy.